All right, guys, I'm back from the dentist, actually the oral surgeon, and then my dentist today because I had that procedure done. It's going to be a while before it actually is fully done and in place, but I have decided to get an implant in my front tooth number 7. It's right next to your double front teeth. It's on this side, which is my right side. Looking at me, it's your left, and it's this one tooth over here. I tried Smile Direct, and of course it tried to bend and shape these teeth, and I did that a couple years ago, and I always had a problem with this one because it was out so far and really trying to push that back into place, and it never did get solid because it started hitting the bottom teeth once it started trying to get back into line with my front teeth. So today I had the first appointment, and in this appointment, the oral surgeon did extract that tooth because it's been loose and it's been getting infected and stuff because, you know, the looseness of your gums around it. Anytime you eat greasy foods and stuff like that, it would get infected no matter how much I use the water pick and toothbrush and stuff like that. Some grease and stuff and food greases would get up in there and it would get infected, and it just started doing that. It did it about a couple times this past year, so I decided, you know, I gotta get this thing addressed. I don't want a funky smile like I have now, because today was the day. This morning, early in the morning, I'm not a morning person, so it was heck for me to get up this morning, but I did it because I want to get this resolved, and it's going to take probably about 8 to 9 months, because the first step, I have periodontal disease. That's where my gums recede, and I already had laser surgery about 10 years ago to try to correct some of that, and it did. And I do have teeth cleaning, deep cleaning done about every 4 months ever since then, and I've been able to subside that periodontal disease somewhat. And so I really take care of my teeth now, unlike I did when I was a kid. So this is I wanted to put this video together so you can understand the processes and know, you know, what is involved. So the first step was I went and had this tooth extracted today. And the oral surgeon said, all right, we're going to extract the tooth, and then we're going to pack it with bone filling graft. And they didn't take the graft from, sometimes they go in under here, under your chin here, and take some bone from your chin or back from your jawbone. That's for major bone grafting, but they have like particle bones that they use from cadavers or cow bones and stuff like that. It's even synthetic bone, crushed bone material. And so I had the tooth extracted today, as you can see. Kind of funky. At least we're all wearing masks now, right? So it doesn't get to show that often. And it just happened this morning. And then I'm going to give you a gruesome view. You can fast forward if you want, or just stop the video. But I'm going to show you up in here. You'll see a piece of cloth in there, and that's a membrane that they put over top of your bone grafting material to hold it in place. And then they put a few stitches to bring your gums together around that material and hold it. In 2 weeks, I got to go back and get the stitches cut out and get the bone graft removed, the bone, or not the bone graft, the membrane that's holding the bone graft kind of together, trying to create a bridge along there between the two teeth, the other teeth right there. And she'll remove that membrane material and cut the stitches, and then she'll put some dissolvable stitches in. And then we're going to let that bone graft set. You got to let that bone graft set for about a good 3 to 4 months. So maybe even up to 6 months. I'm hoping for the lesser, right? So after I go back in a couple weeks, I'll have that removed and stuff. And then I'll have to wait about 4 months, 6 months maybe, for that bone graft to get solid and have a nice solid bone there to where they can drill into that bone then and place the implant I call it a stud, but it's like a screw-in socket that you can screw in a crown on top of that, and it would be more like a permanent tooth, and you won't be able to tell which tooth is fake or whatever, and it will feel just like one of your own teeth after that implant's up there. But let me show you. I'm gonna go get this thing, because right after I went to the surgery for the extraction today, I got a kind of like an Invisalign retainer thing that goes up over here, and the dentist, my main dentist, general dentist, put a tooth filling in there, so I can start wearing that. I tried to put it in today. He said, no, you can put it in before you leave today, but I said it started to aching because I started to feel bruising after that. You know, I went about half hour after the surgery. I was still numb up here, and by the time I got to the dentist's office, my general dentist, I was sitting in a chair and started to feel like it was really bruising up here, and it was swollen on my upper palate behind there where they packed in that membrane and the bone grafting material. And I said, you know, I don't want to put it in right now. I'll wait till I get home. And actually, I think I'm going to wait a day or two, because I'm not going anywhere in the next day or two. I'll wait a day or two before I put that thing up in there. I tried it just a little while ago, about an hour ago, and the whole tray, I'll show it's like a clear Invisalign tray, was starting to fill with blood because I disturbed the extraction site there and the bone graft site. So I was like, you know, I'm at home now. I'll be okay, and let me wait a couple days to put that in. But let me show you that. I'll be right back. Okay, I'm back. This is my general dentist, Thompson Dental, right here, and he does a fantastic job. He's in Trinity, Florida, near Tampa. And if I open this thing up, I'll show you. It's an Invisalign tray. Same thing I did with Smile Direct, where they try to straighten your teeth. You have to put different ones in after a few months, and it starts to straighten your teeth around here. But this one I could never get really in line. And look at this, it's got a tooth, a makeshift tooth. It's not real. It's poured in there. I don't know what material he uses, but it's right in the spot, and he made sure to kind of straighten it for me, so it would look like I have straight teeth after I get this in. That won't be sticking out anymore, like up in this picture here. I'll show you. You would have seen it on my other videos. By the way, check out my other videos if you like home show automation, vehicle stuff, smart gadgets, anything like that. Be sure hit the subscribe button. I'll keep you up to date on this procedure as well. And so this is what it is. It's an Invisalign tray that will fit right up there, and this clear casing there goes over my other teeth, pops right in. You can't tell. I'll come back in a day or two and I'll leave a little short video and show you how this looks in place. One more thing before we go. I'm going to tell you about my anxiety before I went this morning. So I took the one pill of Valium last night, and watching TV, ate some dinner, a quick dinner, and sitting there watching TV. I'm like, I'm still thinking about my surgery. This Valium is not going to do anything for me. And my wife works at home now, so I'm like, you know what, honey? Don't do it. I don't need you to take me. I'm just going to do this like a brave little boy and just get the numbing done. I know I can handle it. So that's what I did. I didn't take the Valium this morning. I just went there. They numbed it up. Could hardly feel the pricking of the needle going in with the numbing solution, Novocaine, whatever they put in there nowadays, and numbed it up. Within 10 minutes they were in there with the tools. They were able to yank the tooth out. It was already loose, like I told you, so that wasn't no big deal. I didn't hardly feel it. I kind of felt in my mind some cracking and nudging, but I couldn't feel this area at all. So that was nothing. And then they quickly went to, I guess she spread out my gums right there in between these two teeth. And then she started, asked the assistant for the other solution, the bone grafting solution, put that up in there. Put the bone grafting up in there. Next thing she asked for the other piece, and that was the, I don't know if it's felt or whatever, some kind of cloth material. And she stuck that up there. And then next thing you know, she was asking for, you know, the stitching stuff, and she stitched a couple times and boom, it was done within 35 minutes. I was so impressed. I didn't feel a thing, guys. So, and then I asked her before I left, I said, all right, I know this procedure now, I know how I'm gonna feel with this, nothing. How about when I come back in 4 or 6 months from now, and you're gonna do that drilling up into my bone, my jawbone, to put this stud in there, or sleeve, screwed in sleeve. How is that going to be compared to this? And she said, that's going to be about 45 minutes as well, and it's going to be the same or less. So guys, I'm happy with this, happy with the result so far. I can't wait to have this whole thing finish. It's probably, let's see, it's going near the end of March now, so I'm not going to see an end to this and have a real tooth put back in here until probably my general dentist, he says probably not until October or November this year. So it's a process, a little time consuming, but I need that bone built up, need it strong. I advise you guys to go ahead and do it, and don't be nervous about it. Just go ahead and do it. If you want to, you can spend that extra $600 to get the general anesthesia, and I'm sure you'll just be knocked out and you won't know what happened to you. But you'll need a driver then, but you don't need it. Alright guys, until the next one, I'll explain more later. I'll see you on the next one.
Wherever love goes, there is also misery. It's no mystery. And you and I, we got history, yeah. Wherever love flows, there is also tragedy. When we're in too deep, and you and I, we got history, yeah.